April is Alcohol Awareness Month, the time dedicated to shedding light on the impact of alcohol use and abuse while encouraging meaningful conversations around recovery, support, and healing. And joining us this morning is John Brunty, a sober recovery coach who not only helps navigate sobriety, but also inspires hope through his own lived experience. John, I'm so grateful you're with us this morning.
It's always good to be here. Thanks for having me.
Absolutely. All right, I want to start by asking you to share a little bit about your journey and your experience with recovery.
The first time I got drunk, I was 15. By the time I was 25, I'd been to jail 5 different times for drug and or alcohol related issues. And by the time I was 35, because that wasn't enough, I ended up in a liver specialist's office with him telling me, we need to get a good look at your liver in 3 months to know whether or not you have is chronic. And I thought, I've got to wait 3 months before I find out whether or not I have a chronic liver disease. And he said, yeah, and it was something he said so casually. And it was the worst thing that ever happened to me. And he was about to tell me the best thing that ever happened to me. He said, yeah, so don't drink for 3 months. And I was like, did he say 3,000 years or did he say 3 months? But he said 3 months, and I was so sick at the time and so worried about everything that I really wanted to give it 3 months and see. And that began my journey.
What an incredible story. And I also appreciate you being vulnerable and opening up about that because it's not an easy conversation to have. I want to transition now a little bit to, I know that this can be a taboo topic. It's one of the reasons why it's hard to be vulnerable. So what are some misconceptions about addiction or recovery?
I think the biggest is that addiction is a moral failing and not a health issue. And even for me, it took me a long time. I had heard for years that alcoholism or addiction is a disease. And I knew that, but when I applied it to myself, I didn't believe it. And I felt like I was giving myself an excuse. Even though it landed me in jail 5 times, it got me sick enough to be at a liver specialist, and all the things that have happened to me, I still didn't respect it as a disease. And I think that, and if I don't respect it, then someone that doesn't have it is definitely not going to respect it as a disease. And I think that really stands in the way that, because people think that it's something with their morals, that they're not getting better. And really what I've come to learn is those of us in recovery are sick people trying to get well. We're not bad people trying to get good.
That is so powerful. If somebody is feeling ashamed right now to even admit that they might have a problem, what is some encouragement that you would have for them?
For me, shame and guilt, this addiction thing thrives in shame and guilt. And that shame and guilt is your disease telling you that. It's the whole addiction thing, because if we feel shame, if we feel guilty, that's our way back to leaning on the substance or substances that became coping mechanisms in the first place.
For folks who are like, okay, I realize I do need to get help, what are resources out there?
There's so many other pathways to sobriety, because 12-step meetings aren't for everybody. And I've certainly learned that, and I work with people that do that. I am very closely related, as you know, to the Courage Center, and they do all recovery meetings. So whether you got sober through Celebrate Recovery or 12 Steps or Refuge Recovery or whatever it is, you can go to these meetings at the Courage Center and just be in a group of people struggling with your same issues. Because no matter what, there's some substance or substances became a priority in our lives, and that's the most important thing to talk about that and be around that, no matter what pathway it is.
I love that. So I think one of the biggest things is saying, hey, there are resources available. I hope if you're listening, that's one of the big things that you took, is that you can beat this, and there are resources out there to help you through this process. Now, we're going to put this information on our website, WLTX.com, so you can check it out if you need help or if you have a loved one who is going through this as well. Again, this will be on our website, WLTX.com.